This is a C. Jason podcast, and my name is Manish Sood, and I'm a nephrologist, associate professor at the University of Ottawa, and senior scientist at the Ottawa Hospital Research Institute in beautiful Ottawa, Canada. I would like to discuss a recent project from my research team, which worked to develop a publicly available web-based calculator so that people can understand their risk of developing new chronic kidney disease defined as an eGFR of 60 or lower without medical testing. As early chronic kidney disease is entirely asymptomatic, detection normally relies on identifying high-risk individuals and testing their blood and urine. Unfortunately, CKD awareness among the public is extremely low, often less than 20%. This contributes to a culture of low disease awareness overall, and this is believed to be an important first step in detection and prevention. Simple and cost-effective interventions to help identify individuals at risk for developing CKD could play a major role in disease detection and improve overall health. To date, most risk calculators were designed targeting physicians or healthcare professionals and often require detailed clinical information such as blood pressure and laboratory test results. To address and overcome this, we developed and validated a simple risk prediction tool termed CKD POP-T to determine the risk of incident CKD, and the risk tool targets the general public. We use data from the Canadian Community Health Survey, a random periodic community-based survey that collects detailed information on sociodemographics, lifestyle, diet, and overall health based on self-responses. And we link this survey data to administrative laboratory data. We focused on predictors that would be widely known to the general public, such as basic demographics, comorbid conditions, health behaviors, and lifestyle factors such as smoking, alcohol use, diet, and exercise. Our cohort included 20,200 participants with an eGFR of 70 or greater at study completion, and they required a second eGFR measure up to 8 years later to define the study outcome, which was an eGFR of 60 or lower. As most participants would not know their own GFR, we created models with and without an eGFR measure. The mean age of our study cohort was 55. 58% were women, and the mean baseline eGFR was 95 mils per minute. Over a median follow-up of 4.2 years, 9% of participants developed an eGFR of 60 or lower. Our final model included age, sex, lifestyle factors such as exercise, behaviors such as cigarette smoking and alcohol intake, comorbid illnesses, hypertension, diabetes, and cancer, and an eGFR if known. Our final model performed well with C statistics of 0.84 and 0.81 at 5 years with and without a baseline eGFR respectively. Calibration was excellent. For example, the predicted 5-year risk was 9.67% with baseline eGFR and 9.72% with no baseline GFR, compared to an observed risk of 9.8%. Our model performed consistently well when we used 2 eGFR measures to define our study outcome. We further externally validated our model in 15,522 participants from the UK Biobank. The 5-year C statistics were 0.78 and 0.66, with and without a baseline eGFR, respectively. Self-reported survey-based tools such as the CKD POP-T are emerging means for individuals to be empowered in terms of their own health. CKD POP-T has several strengths and potential applications. Firstly, it would allow people to assess their risks without self-perceived bias from healthcare professionals. It is not always easy to openly discuss detrimental health behaviors, and the CKD POP-T could serve as a neutral calculator to assess risk. Secondly, it is relatively simple and can be used as a cost-effective means to improve CKD screening in the public. Thirdly, it can be used to identify individuals at low risk, potentially alleviate anxiety. Fourthly, risk can be determined without knowledge of a baseline eGFR or ACR, tests that are not always measured or known. Lastly, it could be web-based and coupled with personal education materials with the overall goal to reduce risk.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.